I know for I know for training, we turn off our camera so that it's not distracting and it helps the bandwidth. Do you guys want me to keep my camera on or turn it off?
Totally up to you.
Okay. All right. I might just keep it on to make it a little bit more personal.
Okay.
Hi, Debbie Lee.
Good morning, everybody. Gonna let people start filtering in here, and then we'll get started.
Debbie Lee, would you like for me to get a bag of chips and crunch them really loudly in your ear? We were at a conference and somebody was eating chips and we were like, what the heck? And it was like, that's kind of our joke.
Oh, man. All right, everybody. So let's get started. Welcome to our October webinar. We are very excited. So we have Medicare OEP is coming, and it's here, Medicare updates for 2025. Just if you're not familiar with our Zoom format, you are automatically muted, but if you have any questions for Jeannie or Lauren, you can just plop those into the chat box. You won't be able to see other participants, but you can see the speakers and the hosts. We are recording today's session, so if you want to come back and listen to it, or if you want to share it with somebody else, it will be posted on our website. And I know people like to get their certificates of attendance. So if you're here today, you will get that. So be excited. It'll be in your inbox in about a week. All right. So today we have Jeannie Skepsey and Lauren Hevner. They're both with the SHIP division of the North Carolina Department of Insurance. And I'm going to go ahead and turn it over to them because I know they have lots of information to share with us.
Good morning. My name is Jeannie Skepsey, and I am the SHIP Field Operations Manager, which means I am the lead of our wonderful regional manager team at SHIP. There are 5 of us that take the 100 counties of North Carolina and divvy them up. And most of the regional managers have 20-some counties, but because I'm the leader of the team, I only have 9 counties, and I'm actually based in Greensboro. So in addition to being the field operations manager, I'm also the central regional manager managing Guilford County and the 8 counties that immediately surround Guilford. And we also have with us this morning, Lauren Hevner, and Lauren is our current SHIP Piedmont regional manager, and Lauren does serve and support 20-some counties in the Piedmont, and Lauren is actually based in Lincoln County, in Lincolnton. And we're just pleased to be here with you guys this morning, closing down the week, if you will. And Lauren, before we get started, is there anything that you would like to say as the regional manager for this area?
Just good morning, everyone. Thank you for joining us, and feel free to ask whatever questions that you may have, either during our session or follow up with us after. And thank you again for being here.
Thank you, Lauren. And Lauren's actually going to be our Vanna this morning. She's going to be manning the chat box and answering any questions that come up, and also questions that we think might need to be presented to the entire group. Lauren's going to filter those to me for me to answer those out loud so that everyone can hear them. So Lauren, the first thing, if you would like to type our SHIP and SMP contact information, our toll-free phone number, as well as our website. So as it was mentioned, Lauren and I represent the North Carolina Department of Insurance, and we bring you greetings from our Insurance Commissioner, Mike Causey, and the rest of the Department of Insurance staff that can't be here with us today. And with the disaster of the hurricane that came a few weeks ago, some of our Department of Insurance staff are very, very busy with efforts out in the West. And we just want to continue to remember and say a little prayer for those people that were affected by Hurricane Helene a few weeks ago. So hopefully you're familiar with SHIP, which is SHIIP. It stands for the Seniors Health Insurance Information Program. And because that's a mouthful, we call it SHIP. And SMP is the Senior Medicare Patrol Program. So let me just tell you a little bit about SHIP. It is a division of the North Carolina Department of Insurance. So again, Lauren and I do represent the state. And SHIP was created in 1986. And back then it was the first, or actually the second program in the country to help people with Medicare questions. And at that time in 1986, we received state funding. And then 6 years later, in 1992, The federal government had been watching what we were doing for about 6 years, and they said, look at what North Carolina is doing for their people that are on or going on Medicare. Every state in the country has to have a program like that. And we were called Insurance Counseling and Assistance Programs, or ICAs, back then. At some point, the name changed to SHIP, State Health Insurance Assistance Program, and we started receiving federal funding in addition to our state funding when the federal government mandated that every state have a SHIP, and we're very appreciative of that federal funding. So every state has a program as of 1992 to help people with Medicare questions. Now, the S in SHIP stands for seniors, and that's a little misleading because our goal is to assist anyone, regardless of age, that is going on or already on Medicare with their Medicare-related questions and problems and concerns. We do that in a neutral, objective, and unbiased fashion, meaning we don't sell insurance and we don't make a commission, and our services are provided at no cost because of the state and federal funding that we receive. We collect financial information and medical information and reassure our clients that anything that they share with us is kept confidential. We only use that information to assist them and then also document that we assisted that client, which supports our funding. And then as we're assisting people, we remind them our goal is that they get the best coverage at the best cost. That's why SHIP is here. So we do what we do by having an office in Raleigh because we're a state agency, and we have a toll-free number that Lauren has typed in the chat box. That toll-free number, which is 855-408-1212, is not just a SHIP Medicare number. It's a Department of Insurance number. So if you have any kind of questions related to insurance, whether it's health insurance for Medicare or non-Medicare, automobile insurance, homeowners insurance, life insurance, you may call that 855 number Monday through Friday, 8 a.m. to 5 p.m. and listen to the menu and press the proper number, and you will get to the division that can assist you with whatever insurance related question or issue you may have. We have a call center that's at the SHIP office in Raleigh, and I'm pleased to say that as of several weeks ago, it is fully stocked. So we have a great team of people that are there to assist you with Medicare questions, again, at no cost, in a neutral, objective, unbiased fashion. Because it is open enrollment, our call center is a little bit busier these days. So if you call, you may have to hold, but they say things that you wait are hopefully worth waiting for. And when you get through to our call center, it certainly is worth waiting for because those people are very knowledgeable and very helpful. We also have a wonderful website for those of you that have access to a computer. Lauren also typed that in the chat box. It's www.ncship, that's SHIP with 2 I's.com. And that's available anytime, Monday through Friday, 8 a.m. to 5 p.m. plus. And so if you have access to a computer and your internet's working and everything's good, then you should be able to access our website at any time. And it is very user-friendly. But if you can't find what you're looking for and it is normal business hours, please call us and ask us to help you navigate that website. It's got a lot of good information out there. We also have some materials and publications that we put together at SHIP for North Carolina residents that are Medicare beneficiaries. And we also have a few documents that are printed and distributed by the Centers for Medicare and Medicaid Services. That's the federal agency that administers Medicare and Medicaid. So if you want a booklet or a publication or a pamphlet or a document, reach out to us, and if we have that, we will share it with you, or we will tell you where you can find it on our website. Then you can get it quickly, and we don't have to mail it. It saves trees and postage, and you have it right there at your fingertips pretty quickly. We were set up in 1986 a little differently than a lot of agencies, and this is what makes our program special and unique. In addition to calling our toll-free number in Raleigh, we also have a hub or a coordinating site in every county of North Carolina. And that hub is the liaison between the SHIP office in Raleigh and people in the communities that need assistance. So for example, you may have a Shepherd Center, as it is in Mecklenburg County. You may have a senior center as it is in Lincoln County. You may have a cooperative extension office as it is in Surrey County, a council on aging like they have in Union County. So usually it's an aging provider or organization, but not always, that agrees to accept SHIP funding, and they contract with us to be our extension in that community. So we operate on volunteer counselors to help people locally, face-to-face, one-on-one, again at no cost, in their community. So people don't have to call Raleigh or drive to Raleigh. They can get help locally in their community. And in a little while, Lauren and I are actually going to show you how to locate the SHIP coordinating site in the counties of North Carolina, as well as the SHIPs in other states, in case you know someone that's on or going on Medicare outside of North Carolina. So again, we help people in a neutral, objective, unbiased fashion. Our services are provided at no cost. Any medical or financial information that is shared with us is kept confidential. And our goal at SHIP is that that client has the best coverage at the best cost. So that's what we do at our SHIP program. We have a sister program called North Carolina Senior Medicare Patrol, and every state has one of those, just like every state has a SHIP. And SMP talks about Medicare fraud and abuse. They tell people it's out there, and then they tell people how to avoid fraud and abuse and how to keep your eyes and ears open. And we're going to talk about Senior Medicare Patrol a little later on. But every state has an SMP. Our SMP is based within our SHIP in North Carolina, which again is within our Department of Insurance. So as we're talking to people, we remind them about Medicare fraud and abuse and tell them how to reach out if they suspect that something fraudulent or abusive is taking place, so that it can be investigated and hopefully stopped. So that's a little bit about our SHIP and SMP programs. Does anyone have any questions about our programs before we move on? And Lauren, do we want to show the SHIP website at this point and show them how to locate the SHIP in coordinating sites in North Carolina, as well as the SHIPs in other states?
Yeah, I think this would be a great time to do that. And we don't
Okay,
have
thank
any
you.
questions at this time. And I will put the link for you to directly access the search feature on our website after we show it.
Perfect. Thank you, Vanna. And while Lauren's pulling that up, as I mentioned earlier, our SHIP website, I feel, is very easy to navigate or find. I can find what I'm looking for normally. Sometimes I have to reach out and say, okay, guys, where do we put this? But this is what our website looks like. It does identify in the upper left that we are a division of the Department of Insurance. And then if you pull down, there's a banner at the top that now has 5 panels, if you will. We just added one the other day that Medicare Open Enrollment is here, but Breast Cancer Awareness Month is upon us. It's Pink Ribbon Month. We have a tic-tac-toe or Brady Bunch board below, but let's go to wherever you want to click, Lauren. There's 3 places in the banner at the top, in the tic-tac Brady Bunch board in the middle, and below in the lower left where it says more, there's 3 different places that you can search for a SHIP counselor by county. And Lauren has gone down to the lower left area of our website and click there. And if you scroll down, you can see in North Carolina, and if you pull that arrow down, it then allows you to pull another arrow down. And so from Alamance to Yancey, it does list the SHIP coordinating sites for 100 counties. Now, there's a few counties that currently do not have a SHIP coordinating site, but Lauren clicked on Mecklenburg, since that's where the Centralina AAA is based, and it does not give the name of the coordinator. in case they're not there at that agency. So in Mecklenburg County, you can call the Shepherd Center of Charlotte, and it gives the phone number as well as the address, and ask for ship help. And let's say, for example, Alyssa, the coordinator, is not there on site. Then when that call goes in and you ask for ship help, that person's going to hopefully know what to do to take that call or to screen the call and then pass it on to the proper person. And so that it has the information for that coordinating site minus the coordinator's name. To find a ship in another state, you pull that down and you click how to find ship in another state. And then it'll take you to another screen, and I think there's an orange ship locator. And SHIP stands for State Health Insurance Assistance Programs. That's what every state has, but we have our own individual numbers. And let's say, for example, Lauren, you just pick a state. Okay, South Carolina. So their South Carolina program, they just have SHIP, and it gives their toll-free number and website. And then if you want to click another, Lauren, in the lower left where it says ship locator, click on Ohio. This is my favorite. I love their logo, but they're called OSHIP with a P at the end. Got to be careful how you say that one. And so their SHIP is called the Ohio Senior Health Insurance Information Program, or OSHIP with 2 I's. And it has their information. They actually have a Facebook page link as well as the website and an email address. So there is a SHIP, SHIP, in every state if you know someone that's in another state. Thank you, Vanna. So hopefully, if we demonstrate these things, you'll be able to do them after the training or the presentation is over. And I would highly encourage you to save our SHIP website as a favorite or to bookmark that for future reference. So it's an exciting time of the year. Tuesday, October 15th, started for us a 7-week period called Medicare Open Enrollment. Now, we've been dealing with Medicare Open Enrollment since the fall of 2005, and for 40 years, from 1966 to 2006, people that had Medicare had to pay for the prescription medications out of their pocket. There was no outpatient prescription drug coverage. So, for example, if you went to the local pharmacy with your prescription in hand, or you were at the hospital but you were not admitted, then you had to pay for those prescription medications as an outpatient out of your pocket. Congress, who controls Medicare, decided that something needed to be done to assist people with those out-of-pocket expenses, because as we know, you could get a very inexpensive antibiotic, but you could also get a very expensive specialty medication. And so Congress said, we need to have something in place to help people with those medication costs. So Medicare Part D was born in 2006. And it's hard to think that we've been doing Medicare Part D for about 18 years. And we've seen the value of that program, you all. It does help people with their drug expenses. It helps them save money. If they've got limited income and resources and they qualify for extra help, it helps tremendously. So there are some very good results from Medicare Part D. So Medicare Open Enrollment is the time of year. It's a 7-week period that starts October 15th and goes through December the 7th. And it's the time of the year when you can and should compare your Medicare prescription drug coverage, whether you have original Medicare A and B with a standalone Part D plan, or you have a Medicare Advantage Part C plan and your drug benefits included. Those are the things that you need to compare every year, because the plans change as of January 1st every year. And again, our goal is that people have the best coverage for the best cost. So everyone needs some type of prescription drug coverage. Whether you've got Medicare or you don't have Medicare, everyone needs some type of drug coverage to help you with possible expenses, because again, we know how expensive some medications can be. So even if you take no medicines, or you say to me, I take medicines, but they're all generic and they're not very expensive, we don't know what our expenses are going to be later on. We don't have a crystal ball. So we need some type of drug coverage to help us just in case. And also, we don't want to be penalized, because if you don't take out a Medicare drug plan when you're initially eligible for it, in most cases, then you're going to be penalized later on. And what we're seeing now is those people that did not enroll in a Medicare drug plan when it started in 2006, for whatever reason, they didn't think they needed it or whatever, they didn't know about it, and now they want to pick it up. And when we look at what that penalty is going to be, that penalty kind of overshadows their drug costs and their premiums. So some people are saying, I can't afford it because of that penalty. We want to help people avoid that penalty by reminding them that they do need to enroll in a drug plan. And thankfully, this year and into next year, there is a Medicare drug plan with a zero premium. So when people reach out to us and say, I take no prescription medications currently, that's the plan. Even though we're neutral, objective, and unbiased, we have common sense. There is a plan with a zero premium that we would say this is probably all you need. If you just need a car to drive around town, you probably don't need a Maserati, right? So just something to have in place just in case. And then there are people that take very few inexpensive medications, and when we do a search, that plan may come up as the best for them as well. So it's a 7-week period, and we encourage everyone to compare their plans. You don't know unless you compare. And even those consumers that receive their annual notice of change in the mail, the plan that you're in this year requires that you get an annual notice of change telling you how your current plan is going to change into next year. If it is, they also have to send you an evidence of coverage, which outlines your benefits for next year. And you may also find that you get, instead of an annual notice of change, what I call a Dear John letter. It's a non-renewal notice saying, thank you for being in our plan this year, but we're not going to be in your county or in your state next year, so you need to find another plan. Even people that are good consumers, smart consumers that read those materials, they only see what their plan's going to do for the next year. In North Carolina, because the drug plans vary state by state, next year there are 7 Medicare drug companies that offer 16 plans. So if I get my annual notice of change and it tells me how my plan's changing next year, that's all it's telling me. It's not telling me about the 15 other plans that may be better for me. So that's why we encourage everyone that has a Medicare Advantage plan with prescription drug coverage or a standalone Medicare prescription drug plan to compare their plans every year to ensure the best cost at the best coverage at the best cost. And it's also very important that you look at pharmacies. We are able to put in 5 pharmacies when we do a search, and we want to fill those 5 pharmacy slots because there's out of network, in-network, and preferred in-network. And the prices do vary based on what type of network it is. So very, very important. So I want to remind everyone that you do need some type of drug coverage, regardless if you take medications or not. Open enrollment is here till December the 7th, and you should compare your plan every year. We use the Medicare.gov Plan Finder tool. We receive training on that. We receive federal funding to help people compare, and we encourage you to do that every year. And the first time you put your information in, I think it probably takes a little longer, but in subsequent years, you can go through it pretty quickly. And I want to remind everyone that SHIP is here to help. SHIP in every state receives federal funding. And one of the things that's tasked to us because of that funding that we receive on a federal level is to help people search for, compare, and enroll in the Medicare Advantage or drug plan that they feel is best for them. So please, please, please compare your plan every year during open enrollment. You might come to us and find that the plan you're in this year is going to be the same, best for you next year, but at least you leave with peace of mind knowing that you have compared and everything's all set for the next year. So SHIP is here to help. When we meet with clients, we also screen them for what's called extra help, and we're going to talk about that a little later on. But extra help, we do look at the income and resource and assets amounts, and if we feel people may qualify, we can actually do the application while the client is there with us to be convenient for them, because we are familiar with doing those applications and we receive federal funding to do those applications. And so every person that we touch, we ask questions about their income and their resources and their assets, as well as their health situation, not to be nosy, but to better assess that person's situation and give them the assistance that they need. So the next thing I want to mention is the Medicare and You Handbook. Those were mailed out the end of September, as they are every year. They go out in bulk, 1 copy per household, if there's a Medicare beneficiary in that household. So I'll tell my parents, you have to fight over or share your Medicare and You Handbook. And if a person has elected to receive that electronically, they will not get a paper copy in the mail the end of September, but they will get an email notifying them that the electronic version of Medicare and You is ready. I remind people that that is their owner's manual. If they have Medicare, it's about 130 pages. It's not a novel that you want to sit down and read front to back cover, but it's a great reference source. And we're going to talk about something that's in the front that's important in just a minute, but it's got a great table of contents that tells you what's in each section. There's a section on Medicare supplements. There's a section on Medicare Advantage or Part C plans. There's a section on Medicare Part D prescription drug coverage, and there's a section on extra help. And there's other sections, one for people that are new to Medicare. So that table of contents is very helpful. But if you still can't find what you're looking for, let's say you're looking for something on hospice coverage, or you're looking for something about special enrollment periods, then there is a very detailed alphabetic index that you can look at to receive the where to go pages to help you find what you're looking for. Most every question that I get that's a general question can be answered by looking in that Medicare and You Handbook. And I tell people it's like having the ruby slippers on your feet the entire time. You just have to learn how to use that booklet every year and keep it handy so that you can refer to it throughout the year. The government puts a lot of money into printing and mailing that document, and people don't use it. And so we're trying to really get people to understand how to use that booklet and tell them how important and helpful it is. So with that being said, the next thing I want us to look at is page 2 of the Medicare and You Handbook. And I tell people, if nothing else, and I say it kind of lightly because I do want them to use it for other things, but if nothing else, look at page 2 of the Medicare and You Handbook, and it should have information on what's new and important for the next year. And what I actually did was took page 2, thank you, Vanna, and it's got in blue, in bold, the headings, lowering your prescription drug costs. That's the first one. And if you pull down a little bit, it will give you a little bit of information, and then it will say, go to page 83. So what I actually did was I went to page 83, and the flag that says new, this is the area from page 83. So I copied and pasted so that people don't have to go from page 2 to page 83 or page 2 to whatever the next page is that it tells you to go to. And so we have a one-stop shop here. It's the 3-page document of what's new and important for 2025. And so for people that, want to be in the know of what's happening next year, this is a very helpful document. And you can share it because all I did was copy and paste from the Medicare and You Handbook. And Lauren, I'm just now thinking, this is a 3-page document, but I'm thinking if we can get into what was copied and pasted, how it doesn't go all the way out to the line, we probably can make this a 2-page document. So we might have to work on that one a little later on, but this is very helpful information. So lowering your prescription drug costs, it talks about a cap. We're going to talk about that. Managing your mental health and well-being, that is a hot topic and it's very important. So check out what's new for Medicare there under your wellness visit. More resources for caregivers. I know one of the things that area agencies on aging do and involve themselves in is helping our caregivers. That's a very important job, being a caregiver. So this might be helpful for you guys to refer to your people that reach out to you that are caregivers. The Postal Service Health Benefits Program, there's going to be some changes with that. Federal employees that are Postal Service employees or retirees, they call them annuitants. There's some changes with their coverage starting January 1st, and that's mentioned as well. Changes to telehealth coverage. didn't the pandemic change things for us? If we didn't have the pandemic, Lauren and I might be sitting in Charlotte with the Central Carolina AAA staff conducting this presentation. But I think thanks to the pandemic, we've learned that we can do things virtually. And so I'm in Greensboro, Lauren's in Lincolnton, and the Central Carolina staff are based in Charlotte. And we're making this possible thanks to telecommunication. So this is a very, very good benefit or change, I think. So wanted to point this out. It will be available in the materials that we provide to Central Carolina AAA. Again, please feel free to share that as you need to or refer to it as you need to. So one of the things that's new for Medicare next year that's relative to Medicare Part D, there's a couple of big things actually. One thing is the $2,000 cap on outpatient prescription medications covered by Medicare prescription drug plans. So any covered medication that you take that's covered under your Medicare drug plan, once you reach $2,000 out of your pocket per year starting in 2025, then you won't pay anything else out of your pocket. Now, for me, I take a few medications, but I certainly don't reach that cap. So it's helpful, but not helpful to me. But as we know, there are definitely people, if you take any form of, if you have an inhaler, or you take any form of medication, maybe to help with your diabetes, or people are using it for weight loss, there are some very expensive medications these days. And there are many people that are going to be thankful for this $2,000 cap. It's nothing that you have to sign up for. There's nothing for you to do. You're automatically, when they go to look at your medication cost, it's automatically calculated in the Medicare Plan Finder tool. So you just have to go to the pharmacy and pick up your medications, and this $2,000 cap will automatically be calculated, and it is an annual $2,000 cap. Another thing that's new next year, and I kind of thought, why didn't they just implement the cap one year and then the next year implement this thing we're calling M3P? But they're two totally different programs. And now I see, while both are pretty big deals, why they're implementing both at the same time, because they do two different things. So there is something going to take place starting next year called the Medicare Prescription Payment Plan, and that's a mouthful. So they're calling it M3P. And we always had to stop and go, MP3? No, that's something that you listen to and your music might be on. But this is M3P, and it's the Medicare Prescription Payment Plan. It is not automatic. You do have to sign up for it. And we're going to point out a few things. So Lauren, do you want to bring up the document on M3P?
Yes.
And as Lauren's bringing this up, I do want to mention that M3P, while it's helpful to some people who may have expensive medication costs under Medicare, the beginning of the year, if people qualify for extra help, this would not be beneficial to them. So a person with extra help would not be a good candidate for the M3P program. We did a virtual training. This was actually a slide, and we thought it was very helpful because it does list both the Part D cap, which is in the middle purple column, as well as the M3P in the far right kind of turquoise column. So both of these start January the 1st. And on the left, it says, does this reform lower my prescription medication cost? So for the Medicare Part D $2,000 cap, yes, that does. It limits the amount that you will pay out of your pocket to $2,000 per year. So it does help lower your medication cost. But the M3P, however, no, that does not lower your medication cost, but it does allow you to spread your out-of-pocket medication payments throughout the year. Who's eligible for the Part D cap, the $2,000 cap? Anyone. If you have original Medicare and a standalone Part D plan, or you've got a Medicare Advantage plan with a prescription drug benefit, you are eligible for the Part D $2,000 cap. The Medicare Prescription Payment Plan, anyone that's enrolled in some type of Medicare prescription drug plan, whether it's Part D or Part C, is eligible. If you get extra help, you're not a good candidate, and it's most beneficial to those people with high out-of-pocket drug costs, especially in the beginning of the year. What do people need to do to benefit? For Medicare Part D cap at $2,000, nothing. It's automatic. It's automatically calculated when you go to the pharmacy or you use your Medicare prescription drug plan. And as far as the M3P plan, this is a voluntary program that you must opt into, and you must enroll with your Medicare prescription drug plan. You don't do it at the pharmacy. SHIP can't help you with that. You must do it through your plan, whether it's an Advantage plan with a drug benefit or a standalone Part D plan. And how will I pay for my prescription medications? For the Part D cap, you will continue to pay for your prescription medications at the pharmacy when you pick up your medications, as you've always done. Nothing will change. It's just that your medications under Medicare, if they're covered, are being capped out at $2,000 for the calendar year. With the M3P, each month your plan that you have, whether it's a C or D plan with a drug benefit, will send you a bill with the amount that you owe when the payment is due, and then it will tell you how to make a payment. We compare this to kind of like if you've got Duke Power, for example, and I know that we have this plan, and I don't know what it's called, but we pay the same amount for our energy from January to November. And then when they go to calculate our December, if we paid more than we've used, then they might send us a refund in December. But if we've used more than we paid from January to November, then our December bill might be higher. So it's kind of like that. It kind of makes your medication costs kind of spread out and more affordable. But with Duke Power, we pay the same from January to November. With the M3P, when you look at the cost per month, it's kind of all over the place. There's a reason and a rhyme to it, but it's not the same from month to month. It can be different amounts throughout the year, but it does kind of spread out your medication cost so that you're not slammed with a high cost at the beginning of the year. And then when you reach your $2,000 limit, then you pay nothing for the end of the year. It kind of just spreads everything out, even though it's not a smooth across the board from January to November. And then keep in mind, any prescription changes that are made will affect what your monthly payment's going to be. So very important. The pharmacy can help you identify if you're a good candidate. When you go to the pharmacy as of January of next year, if you are a good candidate potentially for the M3P, that pharmacy is going to get a flag that goes up, and that pharmacy is to let you know you might be a good candidate for M3P, and that's their only role. They then need to refer you to your drug plan, and the drug plan can help you calculate what your monthly cost will be, and they will also enroll you if that's what you want to do in the M3P. SHIP is here to explain what M3P is, but that is our only role. We don't calculate, we don't enroll. Okay? So hopefully that was a clear explanation. And Lauren, were we going to show the little video as well?
Yes, and
All
before
right.
I pull that up to show, I have two questions I think this will be a good time for you
Sure.
to answer. And one of them, I think, I've already answered in the chat for you, Patricia, but I think it would be good for you to address it for everyone. If you're using two pharmacies, will the program automatically check for the amount that has been paid towards the cap?
And thank you for that question. So if you use two different pharmacies to get your medications at, yes, because you're going through the plan. So remember, you're not paying it to the pharmacy, you're paying it to the plan, and that will be in the system. And yes, you should, be paying directly to the plan. So it should work out okay. That's
Thank
a
you,
great
Jamie.
question.
And the second question came up during the last slides, but can Medicare Part A pay a copayment at a doctor's visit? Can you discuss the differences briefly of Part A and Part B,
Okay,
what they
yeah,
cover?
so this is kind of out of the open enrollment period scope, but if you have original Medicare with a red, white, and blue card, it's been around since 1966. You can go anywhere. There's no network, there's no service area. It's the most flexible option for Medicare. But Medicare Part A is the inpatient hospital part of Medicare, covers inpatient hospital if you're admitted, skilled nursing if you meet the requirements, home health for a certain amount of time at a certain point. And hospice, if you elect hospice services because you're terminally ill. And so Medicare Part A would be the coverage for that. Medicare Part B is the outpatient or medical part of Medicare, your doctor visits, home health, if it's not covered by Part A, outpatient hospital, medical equipment and supplies, and those kinds of things. And so Medicare normally, in most cases, unless you're still actively working or your spouse is, Medicare is going to be primary. And because Medicare A and B both have deductibles and copays, we would encourage someone to invest in a Medicare supplement policy to fill in the gaps where Medicare Part A and B leave off. Has that answered the question?
I believe so, but whoever chatted that in, it came in anonymously. Please let us know if it did not, and we will provide further clarification. And Jeannie, I'm going to go ahead and queue up and play the video. Just let me
Perfect.
know if it does not play sound.
Thank you.
An official message from Medicare. If you're like me, you might have a high-cost prescription or two. And when I fill those at the beginning of the year, that means a lot of money coming out of my pocket at the same time. Starting in 2025, there are a couple of changes to help people like us. The prescription drug law caps your out-of-pocket drug costs for covered drugs at $2,000 in 2025. Also, there's the new Medicare prescription payment plan. It's offered by all Medicare drug plans and by Medicare health plans with drug coverage, including Medicare Advantage plans. Here are 5 things I learned about the Medicare prescription payment plan that you should know too. 1. It doesn't cost you anything to participate, and participation is voluntary. 2. This payment option can help you manage your out-of-pocket Medicare Part D drug costs by spreading them across the calendar year. 3. Your payments might change every month, so you might not know what your exact bill will be ahead of time. Future payments might increase when you fill a new prescription or refill an existing prescription, because as new out-of-pocket costs get added to your monthly payment, there are fewer months left in the year to spread out your remaining payments. 4. You're most likely to benefit from this payment option if you have high drug costs earlier in the calendar year. You can start participating in this payment option at any time in the year, but starting earlier in the year, like before September, gives you more months to spread out your drug costs. 5. If you use this payment option, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay for your prescription drugs instead of paying the pharmacy. If you want to participate in or need more information about the Medicare prescription payment plan, call your health or drug plan or visit your plan's website. You can also visit medicare.gov/prescription-payment-plan for more information on how this payment option works. This payment option might help you manage your monthly expenses, but it doesn't save you money or lower your drug costs. If you need help paying for your prescription drugs or other health costs, there are programs that might be able to help. Many people qualify for cost savings and don't even realize it. Visit medicare.gov/basics/costs/help for information about cost savings programs. This product was produced at U.S. taxpayer expense.
Thank you, Vanna. So hopefully we found that video, it was short, sweet, to the point. We found that helpful. So hopefully you guys did as well. The next thing we want to look at is the Inflation Reduction Act. We've got a document that we started using a couple of years ago for training, and we just revise it every year. But since we're talking about what's new and important for 2025, we do want to mention the Inflation Reduction Act. That was a law that was passed, and there are some things relative to Medicare and especially Medicare Part D, the changes actually started in 2023, and there's a gradual transitioning in until we reach the year 2029. And the reason that they transition that in is to give them some wiggle room to make changes along the way if they need to do that. So we do have a document. It's a 2-page document. And on the first page, it shows you from the year 2023, when the Inflation Reduction Act started, and it goes till 2029. And under each year, it will tell you what the changes are that are taking place. And let's see, Lauren, that's our SEP update. So the 2025 RA, there you go. Thank you. So it shows you what happened last year in 2023, the things that took place relative to Medicare drug plan. 2024, that's this year. Next year in 2025, it does mention the $2,000 out-of-pocket cap and other drug benefit changes. There's going to be more what's the word I want to use? It's going to make the manufacturers and the plans more responsible for some costs. And so what we do is we move this box down every year and we bold it. So in 2025, the annual prescription drug out-of-pocket cost sharing for the beneficiary is no higher than $2,000. And then they also have the option to break that amount into more affordable monthly payments, which is the M3P that we talked about. The bill also creates incentives to limit drug prices for the beneficiary by shifting more responsibility for the higher prices onto the insurance company and drug manufacturers. And we see what's going to happen for the next few years. And I tell people are asking about those medications that they're going to start limiting the cost. Well, that's 26, 27, 28, and we haven't gotten there yet. And there may be changes before we get there. So let's just focus on what's happening for the next year in 2025. This is a document that you can also share if you would like. We feel like it kind of gives a good picture of the changes relative to Part D that are reflective of the Inflation Reduction Act. We also want to talk about preventive services that are covered. And I spoke to a group yesterday and I said, no matter how you have your health insurance, your plan includes some type of preventive health care. And I tell people our bodies are like our vehicles. You take your car in every 3,000 or 5,000 miles to make sure that everything's okay. And hopefully the mechanic comes out and says, yep, come back in another 5,000 months. We checked your tires, maybe rotated them. We changed your oil. We looked under your hood. Everything's good. But thank you for coming in on a preventive or maintenance basis. And so our bodies are the same way. And hopefully when we go in for these services, we get a check mark saying everything's good. But if we happen to find something that isn't quite right, if we go in on a preventive level, as often as these services are allowed, hopefully they found something early and they can treat it and it's fixable. And so just remember that our bodies are like our vehicles. And the thing with these Medicare covered preventive services, this is an alphabetic checklist that we have at SHIP. If you'll make a note on pages 30 to 55 of your Medicare New Handbook, these services are listed and they're indicated with a little blue apple beside of it. We know what an apple a day does, right? And so we give this to every person that we counsel or we talk about it in our presentations because we want people to know that preventive services are very important. For most of these, there's no deductible to meet, whether you have original Medicare Part B, that's where these are covered, or a Medicare Advantage plan, and usually there's no copay. So pretty much these are at no cost to the beneficiary. So I cannot afford these is not a good excuse. And again, it keeps us healthy and well and may even save our lives. Okay. So pages 30 to 55 of the Medicare New Handbook, look for the little blue apple icon. We mentioned extra help earlier, and when the Medicare prescription drug law was passed several years ago and drug benefits started in 2006, there was a provision of Part D. And what it said is that if you have limited income and resources, then you may qualify for what we call extra help. And we screen every person that we touch. And we tell our counselors, don't assume that just because a person is driving this kind of car or they wear these kinds of clothes. I'll give you a great example. We had someone that worked for an agency that was a SHIP counselor through their work, and they are retiring and turning 65 next month. And I met with this person earlier this week to help them line up things. And I think they're going to qualify for extra help and may even qualify for a Medicare savings program since they're no longer working and they'll be on Social Security income only. And I never would have thought that. So anyway, you just never know. So we train our counselors to ask everyone about income and resources and assets because we don't want people falling through the cracks. And we receive special funding from the government on a federal level to talk about preventive benefits and also to talk about extra help and Medicaid related programs. So make sure that if you do meet with somebody at SHIP that you do have the discussion about your finances. Some things are changing because those people that qualify for extra help have a special enrollment period that they can change their Advantage or drug plans throughout the year. And so this is a very good document because it tells you the special enrollment period changes. And on the left, it tells you the group of people. So you identify whom you're speaking to or whom you're talking to. And then the current rules that are in 2024 are in the middle column. And then on the far right, this tells you what the updates or changes are going to be for 2025 or starting in 2025. So we felt this was a good presentation of what's going to happen with those people that qualify for extra help as of January 2025. So people that currently get extra help or that qualify for it next year and after, this is going to pertain to them. And anyone that has any level of Medicaid, whether it's full Medicaid or a Medicare savings program, you automatically qualify for extra help for your prescription drug coverage. So we would not have to do an application for those people because it's automatic qualification for extra help. So again, please feel free to share this document as well. I know I could quote what the special enrollment period was years ago. You could change plans anytime throughout the year if you qualified for extra help. And a few years ago, they changed to once a quarter for the first 3 quarters of the year. And now they're changing it to this starting January 1. So I might have to refer to this chart for a little while and then hopefully I'll be good to go. And then guess what? They'll probably change it again at that point. But this is a great, great resource to see when people can change plans if they qualify for extra help. Then let's see, Lauren, what else do we need to pick up? Pages 58 to 59. Let's go ahead and click on that one. And we're going to talk about the Senior Medicare Patrol Program. We mentioned it earlier. Every state has a Senior Medicare Patrol, and this is our S&P pamphlet. It reminds people to protect your Medicare card. It is no longer a Social Security number, which is great. It makes it more safe, if you will, but you still need to protect it like you would a debit or credit card, and you may carry it in your wallet or your purse. Just protect it. Never give it out over the phone. Detect, look at your statements when they come out to make sure that everything is accurate and correct and lines up. And I remind people, when you're leaving your healthcare provider's office, get a copy of the statement. What was done to you that day? How much did they charge you? What are the codes? What's your diagnosis or diagnoses? And so keep that so that with your Medicare statement and your other insurance statements come in, you can compare everything and hopefully they all match up, excuse me, and line up. When we're talking about detecting and looking at your Medicare statements, there is a change taking place starting January of next year. Currently, you receive a Medicare summary notice every 3 months, but in your Medicare and You handbook next year on pages 58, there at the bottom, it says soon, starting soon, you will get this notice in the mail every 4 months, unless you've signed up to receive them electronically. So starting in January, you will no longer get a Medicare summary notice every 3 months or quarterly, you will get it every 4 months. And I'm assuming that's to help with mailing costs. And that's a change. So we wanted to point that out. SHIP also reminds you to report. So protect your Medicare card and your Medicare number. Detect by looking at your statements. And then report. If you see something suspicious, call your healthcare provider and question that. Call your insurance company or Medicare. And if you've done those things and you still feel like something's not quite right, please report it to your senior Medicare patrol. Again, our SMP is located within our SHIP in North Carolina. And if it's a simple billing error that needs to be corrected or adjusted, we can help advocate for you for your healthcare provider to do that. But if we do feel like that it is fraud or abuse, we will investigate and send it to the appropriate authorities. And I tell people, think of it this way. If everyone in our country that's on Medicare is wronged by just $1, because you might go, oh, it's just $1, no big deal. But if they're doing it to you, they may be doing it to other Medicare beneficiaries. And if every person on Medicare in the country was wronged by just $1, think how much money is going to be wasted. And so we don't want that to happen. We want to stop Medicare fraud and abuse in its tracks, because Medicare is a great program and we want it to be around for years and years to come. We have a very good Medicare marketing document, and we get questions about this quite a bit. But what I like about it on page 1, and this comes from the SHIP TA, which oversees or kind of informs the SHIPs in all states. But what I like about it is on the first page, it says, watch out for people who, and there's cute little pictures, and this is very appealing to people, so it's easy to read and easy to understand. Then on page 2, there's a chart that has a green check mark or a red X. Plans can do this with a green check mark, and plans cannot do this with a red X. And again, I just think it makes it very simple and easy to understand. And we want people to know what companies and agencies and agents can and can't do, what's within their scope and what's not within their scope. And as I said, we get a lot of questions, so please feel free to use and share this document as you would like to. And when we talk about pharmacies and looking at Medicare drug plans, I call this the egg document because to me it looks like an egg. And sometimes my yolks do look that color if I overcook my eggs. But anyway, when people come to us for Medicare drug plan comparison, there's 5 slots that we can fill for pharmacies. And I'll usually ask them, Lauren, what pharmacy do you currently use? And I'll fill that slot with the current pharmacy that that person uses. I will also ask them, are you okay with us looking at mail order? Because sometimes, as we know, mail order can save a lot of money. Sometimes it saves very little, and I tell that person, might not be worth your time. And then sometimes mail order is more expensive, but I like getting a big picture. And then the other 3 slots, I will ask them what pharmacies are conveniently located to you. I don't want you driving 10 miles to save a penny on a gallon of gas, but are there other pharmacies in your area that you would be willing to go to if it saves you money? So when we do a search in the Medicare.gov Plan Finder tool, it does tell us with a green check mark if it's an in-network pharmacy or preferred in-network pharmacy. And you'll see the graphic here. But if it's out of network, there's a big red X. And not always, but normally, there's a difference in price if it's out of network. And sometimes, and you AAA people, especially if people are residents of a facility that uses a certain pharmacy, sometimes they're in a plan, a Medicare drug plan that doesn't work with that pharmacy that that facility uses. And I've seen the big red X, and it's tens of thousands of dollars difference. So we need to be getting the word out to facilities where people reside that they use a certain pharmacy to be checking their Medicare drug plan. And I was told one time, like that DSS or the state pays that. Well, that's wasteful. We don't want that. It might not be coming out of the beneficiary's pocket, but that person needs to be in the best plan according to the pharmacy that they're using and the in-network or preferred pharmacies. So very, very important, but we feel this is a helpful graphic to explain that. And also there's prior authorization, step therapy, quantity limits. We look at those things if they pop up as well, because those are things that we need to consider. Okay. So Dana, I think that's all the slides we have, and I've crossed everything off of my list here, but I do want to go out with this, and we've got one more minute. If
We
you
have
feel
one
the
last
calling,
question too.
say that, Lauren.
We have one last question
Oh,
too.
all right. You go ahead, and then I'll close up with our volunteer recruitment statement.
Okay. So pertaining to the Medicare MP3 patient payment, The question is, shouldn't your drug costs be about the same each month? What is the reason to spread out?
So that's a great question. Hopefully you guys heard that. Shouldn't your drug costs be the same about each month? So again, this M3P is going to be more helpful for those people with expensive medication cost, because remember, it caps out at $2,000. So let's say your medication costs are $500 a month. So you would cap out in the fourth month. So instead of paying $500 in January, February, March, and April, and then be done with it, what they're doing is they're taking that $2,000 cap and they're spreading it out throughout the year so that you're not paying 500, 500, 500, and 500. Does that make sense? So it may not, M3P might not be good for people, or might not be helpful for people that take very few inexpensive medications, let's say generics, or things that aren't very expensive, but it may be very helpful for people that take expensive medications that you would be paying more upfront when you cap out. But then what they're going to do is spread those payments out throughout the year. There's some examples, and we look at those examples, and you see the prices are all over the place. They're not the same from January to November. And that's why it's a little hard to explain. But if people think that they might be a good candidate, or they're interested in finding out, am I a good candidate, they should reach out to the Medicare drug plan that they have, whether it's a standalone plan or a Medicare Advantage plan with a prescription drug benefit. Remember, if you're extra help eligible, not needed. Okay. So hopefully that makes sense.
And just in closing, just a clarification is needed for the difference between, again, for preferred pharmacy versus in-network. They didn't quite understand.
So preferred means that it's a different level, and it's in that graphic that we had. You may find a better price at a preferred versus an in-network. It has to do with what the pharmacy's getting, but not always. I have seen an in-network pharmacy have a lower cost than a preferred. So it's kind of a back-end thing. It may not benefit you to get your medicines from a preferred pharmacy, or it may. It just depends. The Medicare Plan Finder tool will outline that for you, but it's actually about the pharmacy's contract with the Medicare prescription drug plan. Okay. So your bottom line is, what am I paying, whether it's in network, out of network, or preferred? That's what we're looking at for you. And again, preferred, sometimes it's less expensive, sometimes it's not. It's just whatever the Medicare Plan Finder tool says. I want to go out saying, if you feel like you'd like to learn about Medicare and then put back to others in the community that need your assistance and help, we would love to have you. Our counselors would tell you that it's very rewarding. Some of our area agency on aging people staff are SHIP certified as well. Reach out to your local county coordinator to get that ball rolling. It is an online certification, and then once you've graduated, we meet as a county within that county, usually in person, 4 times a year, to make sure that everyone knows of the updates and changes. Because we all know, as you learn something about Medicare and you get used to it, they change it. It keeps us on our toes. So that's all I have. Lauren, is there anything else that you might like to add? Are there any other additional comments or questions?
No other additional comments and questions. Just lastly, a reminder that hopefully you've learned the importance of comparing your plan. And if you need any assistance with finding the local coordinating site closest to you, don't hesitate to reach out.
And thank you, Vanna. And thank you, Central Lina Area Agency on Aging, especially Caitlin and Laura Katie Kusher. We appreciate it. We appreciate you allowing us to share our information. We feel it's very important. And Lauren and I will tell you, it's a busy, crazy time of the year. And when people leave after you counsel them, I'm like, what if that person hadn't come to meet with us? What would their situation be like? And so I wonder, for people that have never compared their plan, what is it like? Are they in a plan that they're paying too much for, premium wise? There's no donut hole anymore as of 2020, and there's no coverage gap. So we're thankful for that. It just makes it a little easier to explain things to people. But thank you guys very much.
Yes, thank you guys for being with us today. Lots of thank yous in the chat. So I just wanted to close out by saying thank you so much for being with us today. All right, everybody, we'll see you next time. I think Katie put in the chat kind of our upcoming webinars, and then also that we're having an in-person conference for the first time, I think, in about 5 years in March. So if anybody's interested in attending, there's some information on our website about that as well. All right. But
Thank
we will
you,
see you guys next
Caitlin.
time. Thank you, Lauren. Thank you, Jeannie.
Have a great weekend.
Yeah.
Thank you. Bye-bye.